In this video, we present follow-up questions of CARD1 from the Ielts Makkar notes September to December 2020 for edition. Use the shadowing technique to enhance your listening and speaking skills. Listen closely to each question, then repeat it to practice pronunciation and fluency. This effective method helps reinforce language retention and boosts your confidence for the Ielts exam. Let's get started and improve your Ielts performance together.
1. Can a hospital function effectively without nurses? A hospital cannot function effectively without nurses, as they are essential to patient care and the overall healthcare system. Nurses provide direct patient support, administer medications, monitor vital signs, and facilitate communication between patients and doctors. Their role extends beyond clinical tasks to include emotional support and education for patients and families. Without nurses, the workload on doctors would increase significantly, potentially compromising patient safety and quality of care. Thus, the absence of nurses would disrupt the entire operation of a hospital.
What are the differences between the work of a doctor and a nurse? The primary difference between the work of a doctor and a nurse lies in their training and responsibilities. Doctors typically undergo extensive education and training, focusing on diagnosing illnesses and developing treatment plans. They often perform complex medical procedures and have a more authoritative role in decision-making. In contrast, nurses are trained to provide hands-on patient care, ensuring comfort and monitoring health conditions. They play a crucial role in implementing treatment plans devised by doctors and often act as the primary point of contact for patients, providing education and support. This collaborative relationship is vital for effective healthcare delivery.
3. Do you think it is necessary to learn first aid skills? Learning first aid skills is essential, as it empowers individuals to respond effectively in emergencies. First aid knowledge can save lives and mitigate the severity of injuries before professional help arrives. It fosters a sense of responsibility within communities, enabling people to assist others during critical moments. Additionally, first aid training enhances awareness of safety protocols and accident prevention. In a world where emergencies can happen at any time, equipping oneself with these skills is not just beneficial but necessary for promoting overall safety and well-being. 4. Do you think that doctors and nurses are not paid enough? Many believe that doctors and nurses are underpaid, especially considering the demanding nature of their work and the extensive education required. While doctors typically receive higher salaries due to their specialized training, nurses often face challenging workloads with relatively lower compensation. The emotional and physical toll of their responsibilities, particularly during health crises like the COVID-19 pandemic, highlights the need for fair remuneration. Ensuring that healthcare professionals are adequately compensated is crucial for attracting and retaining talent in the field, ultimately benefiting patient care and the healthcare system as a whole. 5. Who plays a more important role, doctors or nurses? Both doctors and nurses play integral roles in the healthcare system, making it challenging to determine who is more important. Doctors are essential for diagnosis and treatment planning, utilizing their extensive medical knowledge to manage complex cases. However, nurses are the backbone of patient care, providing continuous support, monitoring, and education. Their close interactions with patients allow them to advocate for needs and ensure comfort. In essence, both professions complement each other, and their collaboration is vital for achieving optimal patient outcomes. Rather than competing, it is more productive to recognize the unique contributions of each. 6. Do you think doctors and nurses are very important? Doctors and nurses are undeniably crucial to the functioning of the healthcare system. They are on the front lines of patient care, working tirelessly to diagnose, treat, and support individuals in times of illness and injury. Their expertise not only contributes to healing but also plays a significant role in public health and disease prevention. The compassion and dedication that both professions exhibit enhance the overall healthcare experience for patients and families. As society continues to navigate health challenges, the importance of doctors and nurses becomes increasingly evident, underscoring the need for a well-resourced and supported healthcare workforce.
Stay tuned for the upcoming follow-up questions of CARD2 from Makkar's notes and tips on enhancing fluency through Ielts shadowing.